This is a really important thing to look at because this comes from directives from our public health organizations and agencies. Lots of people who don't have any symptoms and didn't get ill test positive for this, as well as many people who are ill and have symptoms test negative. So since we don't really know what we're testing, in my opinion, we can't trust the results of this test at all. If someone dies and you suspect it may be COVID-19 related, that not even to bother doing a test post-mortem, just label them on the death certificate as COVID-19.
And the media never says someone died of COVID-19. They died after testing positive to COVID-19. And doctor, now it's become a meme where even the public seems to be catching on, where somebody, some wife shot her husband in her home because they were locked down because of COVID-19, so he died of COVID-19. I mean, it's almost not funny that it's become a joke because the public seems to know that now everything is being overclassified as COVID-19 related.
If they sent them for autopsy, they would probably find that they died of a regular cause. And this would affect the numbers in a bad way in terms of if you're trying to create the appearance that a lot of people are dying from COVID-19. So what I've done in order, since you can't trust this data about the cause of death because of these instructions, and they've essentially gone away from their usual protocols where you want to have some certainty about the cause of death. And they've said that even if there's suspicion that COVID might be the cause of death, that you should just put that as the cause of death on the death certificate without any further scrutiny. Whereas someone's child, I think they were a young adult, died in a motor vehicle accident. And on the death certificate, it said they died of COVID-19, and they were really upset because they had no legal recourse related to the traffic accident to, file with the police or get reimbursed by the insurance company because the death was recorded as being from COVID-19. And so they took this sample of lung fluid, which has genetic material from many sources, and they added an enzyme that would digest any cell membrane. So it basically allows the DNA or RNA to be free in the solution so that they could do further analysis. And then they've identified a sequence of RNA that they allege is from a coronavirus or from the coronavirus family. But the thing is that since this sample is impure and has many sources of RNA, it's impossible to know what the origin of it is. This is extremely weak science, and without purifying the lung fluid sample, you really can't tell what the origin of the RNA is. So they've used this sequence to develop the main diagnostic test that they're using, which is the PCR test. And aside from any problems using the PCR methodology, we simply don't know what it's testing for because we don't know the source of that genetic material. In fact, they call this virus the SARS-CoV-2, is that they looked at the identical nature of the sequences, and they found that it was just under 80% identical. And that's how they said, well, it must be related, and so we'll call it SARS-CoV-2. But the thing is, if you look at the genetic sequence between humans and chimpanzees, you'll find that there's 96% sequence homology or identicality. And so we are clearly not the same as chimpanzees, and no one would say that our genetic material is part of the chimpanzee family. But yet they're using a sequence identity that has a much lower percentage, under 80% compared to 96, and saying that's a coronavirus because of that, where there are scientists claiming to find evidence for a new virus, that they claim to isolate the virus. And I've basically scrutinized their procedures, and I've compared that to the history of how viruses and other diseases are proven to cause disease and how they're identified. So I've become familiar with the procedures and how they work. And what I've found is that the scientific procedures that have been utilized in all of these scientific studies are actually, it wouldn't be possible using those techniques to isolate a virus and purify it and prove that it exists. But in looking at what I do know about the CDC, one thing is that it is mostly funded actually by private industry. So there's something called the CDC Foundation, and you see that all of the major companies that represent the healthcare industry, such as pharmaceutical companies, health insurance companies, medical device companies, etc., are the financiers of the CDC. And they certainly have a lot of profit to gain based on having a serious pandemic and needing to sell vaccines or testing kits and things like that. I think the hospitals are in a different position financially right now. But it seems that all of the policies that they've initiated would have to be for the immediate purpose of inflating the perception of the health consequences of this COVID-19 situation.
Now you tell me something. This social distancing is 6 feet. The technology in the military has been there for 15 to 20 years where they can monitor a soldier as he's behind enemy lines. When they're moving, special operators are always being tracked so that they can be protected, so the backup can be brought in, and they can be seen within a 5-foot radius of where they're standing. This 6-foot distancing, social distancing, this is absolute garbage. There's nothing that leaps 6 foot, first of all. The second thing is that these RF chips, you're telling me that when they insert these things in us, and which the technology's been out there for 4 or 5 years, they've got private companies that are going out there and doing this. I've got video footage on part 6 already of showing people getting RF chip. You don't think that those satellites or other monitoring devices are being able to pick up individuals? They're trying to desensitize us so that people understand, hey, social distancing is going to keep you safe. Whereas in fact, what is being done is so that they can monitor us and see us together. Because if 3 or 4 or 10 or 20 people are together close, they can't tell if it's one person or 10 people. They want social distancing to imprint upon us now that this is something that's new now and everybody needs to do this for protection. Whereas in fact, it's for more monitoring. It's for more tracking. It's for more ability for them to decide who should be available to talk and work and who should be used as a dissident or classified as a dissident and made quiet. So you asked me the question, you opened up the can of worms. That's what I believe. Some people may disagree with me. Most people may think I'm a lunatic. It doesn't make any difference because you know what? It's a part and parcel of what's been coming down the pipeline for years, for decades. The National Vaccine Initiative, stamp out childhood disease. We're not going to have autism anymore. And autism was 1 in 10,000 in 1991. Now the numbers are 1 in 32. The CDC's own data shows that 1% of the world's population has autism. The CDC's own data, the population of the world right now is 7.7 billion. That means 77 million people have autism. Caused from what? From the vaccines. And you're telling me that this new vaccine that Fauci is going to introduce and ignore the hydroxychloroquine and the Zithromax, you're telling me that vaccine is something that I should be considering safe to introduce into my body, into my children's body? I'll be dead before that happens. There's no way that I'm going to allow anybody to take our sovereign right. Thomas Jefferson said that when a people allow a government to dictate the foods they put in their mouths and the medicines to take in their bodies, their souls will soon be in the same sorry state as those who live under tyranny. And that's exactly where we're going. Unless we rise and we en masse people go up and have public gatherings of thousands, 2,000, 3,000 people and show that there's nothing to worry about. There's nothing to fear but fear itself, in the words of FDR. It's one lie upon another lie, Gary. And the American people, not just the American people, the world's citizens, this is affecting the entire world. You all need to realize that this is a facade. And the scientists and the doctors that are keeping their mouths shut, if you're not part of the solution, you are part of the problem. You are creating and perpetuating a myth, and you should be speaking out, not be worried about your own personal safety. Speak out the truth because the rest of the world needs it. The media propagating footage of hospitals and from one country to another country using the same footage, the same person dying multiple times, use of mannequins to show that the people are dying, and yet they can't even show ambulances that are doing anything. They're all parked. They're all sitting there. People are playing chess. They're playing card games because they're so idle. Nurses are being laid off right now because there's not enough work. But they're pushing this agenda of fear, fear, fear. The fear mongering itself will increase your adrenal output, will cause more stress, more emotional distraught. The emotional aspect, one side, now you're talking about the financial aspect. People are going to get stressed. Guess what that does? It reduces your immune system and makes you susceptible to viruses, bacteria, to many other things. But then to create this illusion over something like COVID-19, which nobody has yet demonstrated a single death from the actual virus from the proper, established, accepted methodology that a virus has caused this death. Nobody's been able to do that. It's all based upon PCR testing. Now, 2018, there are multiple studies that show that if you've had the flu shot, especially the trivalent flu shot, false positives on COVID-19 testing. God knows what's been injected into people over the years. They really want to know cause of death. I want to know how many of these people that are supposedly died from COVID-19, which, by the way, still the numbers are less than the seasonal flu. The number of deaths are still less than the seasonal flu. But I want to know how many of these people that died of supposed COVID-19 actually had a history of a vaccination, an adult vaccination in the last 10 years. That's what I want to know, because the studies clearly show that if you've had a flu shot, you're going to test positive for COVID-19. So you got all this other stuff that's going on. They can't justify the numbers, so they're going to change the death certificates. They can't justify the numbers, so they're going to take different footage of different people and then attribute that to COVID-19. They just had, CBS had that nurse that was crying, saying, please give me a face mask so that I can take care of people, and I don't want to risk my family getting them infected. And then they find out that hasn't worked in a hospital in a year and a half, and she's some kind of a social media model. The amount of misrepresentation, deception, diversion tactics to keep the public from knowing the truth, it's just unbelievable. I'm going to ask you a logical question. So here's the president, regardless of whether you are for the president or against the president, forget about that. The man is elected. He's the president of the United States, and it is our responsibility as citizens to follow the directive of our commander-in-chief. Whether you agree or disagree that he went through the process, he got elected. But now the president comes out and says there's a drug called hydroxychloroquine, which has been on the market for God knows 50, 60, 70 years, and another drug, Zithromax, which has been, it's a macrolide that's been around for at least, that class of drugs has been around for at least 70, 80 years. Maybe Zithromax, maybe Zithromax has been around for, I don't know, 20 years, whatever the case is. These are established drugs. They're safe drugs. Using them in combination, there are doctors that have shown at least 99% efficacy. They've shown hundreds and hundreds of patients that have treated. Nobody's died. Symptoms resolve within an hour, hour and a half to a day and a half, 2 days. Okay, so you've got this class. The president brings it out. And Fauci says, get this, Fauci says, unless there's some studies to show that, it should not be used. Yet he's promoting a vaccine that we have no idea what the hell that's going to do. And he's saying that's okay to use. I mean, if that does not show a conflict of interest, I don't know what does. People need to wake up and realize there is a massive criminal component to this. This entire world economy, the whole world economy shutting down, it comes back to one person, in my opinion, and that's Fauci. Now, there's other people that are involved with the charade, obviously, but Fauci is the person that they put up in the front, and Fauci is the one who had the ability to stop this. Fauci has told a friend of mine, Judy Mikowitz, who I was doing an interview with just about an hour earlier, she went to jail and spent 5 years. She was threatened by Fauci 10 years ago when she came out to say that the viral studies and the research that she had done, and she was in charge of doing the research in Ebola to make it more virulent. The gain of function studies on Ebola, she was responsible for that. When she realized the stuff that she had developed and the stuff that she was researching was being used for nefarious purposes, and she was going to be a whistleblower, her career was threatened, and more, her life was threatened. She refused to back down. She went forward, and guess what they did? They framed her and they put her in jail for 5 years. Anybody can go in and do their own internet search. They just need to open their eyes, they need to open up their mind, and they need to be married to no decision or outcome. Just look at it for yourselves, people. You've got your brains. Use your own brain. Come up with your own sequence of events, how it happened. Do the research, and you will, if you're following a logical sequential thought pattern, you'll come to the same conclusion. There's no way that you can come up to any other conclusion. All roads lead back to the same place.